Immunotherapy is an exciting area of cancer research that is changing the way we think about cancer treatment. Immunotherapy works by using the body's immune system to fight cancer. The immune system is a complex network of organs, tissues, and cells, and the substances they make. One of the purposes of the immune system is to rid the body of germs, such as bacteria, and abnormal cells, such as cancer cells. Immunotherapy uses different ways to boost the immune system to do a better job of killing cancer cells. This video describes 3 types of immunotherapy that are used to treat cancer: nonspecific immune stimulation, T-cell transfer therapy, and immune checkpoint inhibitors. Nonspecific immune stimulation is a type of immunotherapy that stimulates a patient's immune response in a general way. In nonspecific immune stimulation, drugs or other substances are used to increase the overall immune response, which can help kill cancer cells. For example, some patients who have had surgery to remove bladder cancer may also be treated with a substance called BCG. When BCG is put into the bladder, it can cause a nonspecific immune response that kills cancer cells that remain in the bladder after surgery. This may keep the cancer from getting worse or coming back. T-cell transfer therapy is another type of immunotherapy. T cells are a type of immune cell and are powerful weapons the immune system uses to fight cancer. For T-cell transfer therapy, T cells are taken from a patient and changed in the laboratory to make them better able to target the patient's cancer cells and kill them. Millions of copies of these specially changed T cells are then grown in the laboratory and given back to the patient to fight the cancer. Immune checkpoint inhibitors are a third type of immunotherapy. Immune checkpoints on cell surfaces help control an immune response. Usually, immune checkpoints keep T cells inactive, that is, in an off state, until they're needed. This keeps the T cells from harming normal cells. Cancer cells can take advantage of these checkpoints to switch T cells off. This keeps the cancer cells from being killed. Immune checkpoint inhibitors are drugs that block the checkpoints. This frees the T cells to attack the cancer. These 3 types of immunotherapy are effective ways to treat cancer, but they don't work for every patient and can cause serious side effects. Researchers supported by the National Cancer Institute are working to learn more about how the immune system works to fight cancer. By studying this, researchers can learn how to improve immunotherapy for all patients.
Over the past 10 years, the use of immunotherapies in the treatment of cancers has exploded. What was once considered a pipe dream by many cancer researchers has now become an exciting therapeutic success story. Since 2011, there have been 7 checkpoint inhibitors, a type of immunotherapy approved by the FDA, which have become the standard of care for 16 different types of cancer. In this series, we talk to the researchers that are making these therapies a reality and explore the technologies that make this promising field possible.
How monoclonal antibodies treat cancer. Antibodies are molecules that our bodies make to help fight germs. Monoclonal antibodies are similar molecules that are made in laboratories and are used by doctors to find or treat cancer and other diseases. This video explains what monoclonal antibodies are and a few ways they're used to treat cancer. Antibodies are Y-shaped molecules that attach tightly to a target. They're very specific, meaning that each antibody attaches to only one target. An antibody and its target fit together like pieces of a puzzle. In the laboratory, scientists can make many identical copies of a monoclonal antibody that can attach to a specific target, such as a molecule on the surface of cancer cells. These monoclonal antibodies can block molecules cancer cells need to grow, flag cancer cells for destruction by the body's immune system, or deliver harmful substances to cancer cells. This makes them a valuable type of targeted therapy for treating cancer. For example, a monoclonal antibody called trastuzumab attaches to a molecule called HER2 on the surface of some cancer cells. Blocking HER2 keeps it from sending signals the cancer cells need to grow. Another example involves VEGF, which is a molecule that makes blood vessels grow. A monoclonal antibody called bevacizumab blocks VEGF. Blocking VEGF stops the growth of new blood vessels that the tumor needs to survive. A third example is the monoclonal antibody pembrolizumab. Pembrolizumab attaches to molecules called immune checkpoints on immune cells. Blocking immune checkpoints helps the immune cells kill cancer cells. Other monoclonal antibodies treat cancer by flagging cancer cells for destruction. For example, when the monoclonal antibody rituximab attaches to a molecule called CD20 on cancer cells, it acts like a flag for immune cells. The immune system sees this flag and destroys the cancer cells. Some monoclonal antibodies fight cancer by delivering drugs, toxins, or radioactive particles to cancer cells. For example, brentuximab vedotin is a monoclonal antibody that is linked to a chemotherapy drug. When the antibody attaches to its target on cancer cells, it delivers the chemotherapy drug, which kills them. Cancer researchers are continuing to investigate new ways to use the precision of monoclonal antibodies to treat cancer patients.